name's Crystal. I'll be your student nurse today. Can I get your name and date of birth? While they're giving me that, I'm checking their wristband to make sure it coincides with what they're saying, and I'm scanning it. All right, great. I'm just gonna be checking your saline lock. I'm giving you a little flush to make sure that that is maintained. So I'm assessing the site. I'm looking for any redness, swelling. Are you having any pain? No? Okay, great. I'm gonna unclamp this. And I'm going to alcohol off the port here for 15 seconds. And I'm gonna let it dry for 10. And while it's drying, I'm getting my saline flush, getting any air out. There we go. I'm gonna attach my flush. I'm gonna aspirate for a blood return. If I get a blood return, I can continue with my flush. If I don't get a return, I'm just gonna gently start my flush. If I don't meet resistance, I will continue with it. If I meet resistance, I'm gonna double check my clamp, or it could be indicative of a clot, but sometimes the cannula, the IV needle gets stuck to the vessel wall or rests on the vessel wall, so you can just push through and see that it is patent and continue with your flush. That I can discard. I'm going to alcohol off the port again for 15 seconds. And then I'll transition into giving them the medication. So now I'm gonna ask, I did ask their name and date of birth. Do you have any allergies? And when I drew up the medication, I did look to see if they had any allergies on their chart. I have the patient name, the drug, the amount, and the date. I have 20 milliliters of ceftriaxone. Are you familiar with this medication? It's an antibiotic that's for your infection. So I'll be giving 20 milliliters. You can give this medication over 1 to 4 minutes. I'll be giving it over 2 minutes. So I'm gonna have 2.5 milliliters pushed every 15 seconds. So now my port is dry. I can connect my medication and we can go. Are you having any discomfort at all? You always want to check with the patient if they're feeling any pain or itching, because sometimes that means that you're giving the medication too quickly and it can cause a lot of discomfort. It can be dangerous in a lot of cases. be discarded. Going to alcohol off the port again for 15 seconds. Holding it firmly in one hand and using friction in the other. You don't want to dislodge any of the IV in there. As I allow that to dry, I'm going to get my 2 milliliters for the flush, and you want to give it at the same rate that you gave the medication, because there is medication still in here and you don't want to just shove that through to them. So you want to give 2 milliliters in about 15 seconds, because I gave my previous one 2.5 milliliters in 15 seconds. So 10 seconds has passed. I can connect my flush. Okay, and then alcohol off one more time for 15 seconds. Remove my gloves, perform hand hygiene, document my findings, and I'll come back in about 15 minutes to check on the patient.